Today, I'm going to talk about a Washington bill that's not in legislation. It's not been proposed. They're not just talking about it. It passed. Now, for those of you that might not know, I live in Washington State. I'm about 30 minutes north of Portland, Oregon. I actually lived in Portland for about a year and then decided there's no way I could live there because of all the craziness. So I moved north to Washington. And now I have sales tax and things like that, which sucks. But I thought, well, maybe the laws would be somewhat better here. Turns out, not so much. What I'm going to be talking about today is Senate Bill 5599. And what this bill does is it allows shelters to keep children from their parents so that they can get abortions or gender affirming care. So let's just jump right into it. The Washington House has passed a bill allowing shelters to keep runaway juveniles from their parents to get an abortion and or gender surgeries that include removing a girl's breasts or uterus. Although framed by proponents as a bill to protect youth suffering from abuse, SB 5599 only stipulates that the minors be seeking or receiving protected health care services for a homeless shelter or host home to avoid informing the parents or legal guardians as otherwise required by state law. Now you're going to notice as I go through this, there's no age put on here. They're not saying if they're above a certain age or below a certain age. And I'm going to show you something else from the Seattle Children's Hospital here in a bit that shows you the ages that this stuff is happening. And you'll be shocked. Because like I said in the previous video, they're going to keep going younger. They're going to go as young as they can. They are going to take this down to the lowest age so that the pharmaceutical industry can maximize those profits, because god damn it, they just don't have enough profits. They just didn't make enough for COVID. So now they're going to make it from gender affirming care. And you know what? Good for them. You know, good for the pharmaceutical industry. Currently, if a runaway minor goes to a youth shelter, the organization must inform the parents or legal guardians within 24 to 72 hours. However, state law provides compelling reasons for them not to do so, including the belief that notifying the parents or legal guardians would subject the child to abuse or neglect. But they don't have to have proof of that. They don't have to have proof of the neglect. They don't have to have proof of the abuse. Yes, sure. There are some asshole parents out there that are abusive, and I think that the kids should be taken away from those pieces of shit. But when you put a blanket on everything like this and you just assume every parent is that way, this is what you get. And I like how it says compelling reasons. Compelling to who? Compelling to the other idiots that are writing this law? Compelling to the people that this protects? Because it's not compelling to me. I want to see the compelling evidence. Let us see the evidence. Instead of just saying the evidence is compelling, it's overwhelming, we're not going to show you what it is, but trust us, it's there and it is very compelling. The bill adds youth seeking abortions or irreversible gender surgeries to the list of compelling reasons while allocating $7.5 million to the Office of Homeless Youth Prevention and Protection Programs for supportive care grants to organizations to address the needs of youth and young adults seeking protected health care services. The bill does not state when or if the parents ever need to be notified of their child's whereabouts. They don't have to let them know. And another thing that I'm going to show you here, and I don't know if it mentions it here, but if the parent tries to find out what is going on, they don't have to tell them. And then after the fact, they don't have to let them know anything that was done to their child. They don't have to reveal anything that happened because it's all protected. As defined by existing state law, gender affirming care includes, but is not limited to, the following procedures. And actually, I just want to show you really quick on this insurance. This is Primera Insurance, gender affirming treatment law now in effect. Now, this is an insurance company. So we can see these are the exact same things that are over here on this. So this is what insurance actually covers. And it's state insurance in some cases as well. So we're paying for it. You and me are covering some of this, if not all of it. Now remember, these are kids that have gone to a shelter or a clinic and are being hidden from their parents. They, on their own, without parental consent, without any kind of supervisor or anybody giving them any kind of sense of reason, can ask for and get the following: breast augmentation, chemical peel, dermabrasion, facial feminization surgery, facelift, facial masculinization surgeries, forehead brow lift, genital modification, hairline modification, hair removal by electrolysis or laser, hysterectomy. A hysterectomy as a child. Children do not comprehend the permanence of that. They do not understand the permanence of these decisions. They're living in the now. That's what kids do. Kids live for right now. Kids want candy right now. They don't think about their teeth in the future. They don't think about their stomach in the future. They don't think about their weight. They want instant gratification. And that's what they're taught from the beginning. Fast food, fast this, fast that, fast internet. Give these fucking kids dial-up for 2 weeks. Make them live on dial-up before they make any decision. Like, this is how it used to be. Just slow down, relax. I mean, that would drive them nuts. Maybe that's not a good idea. Reduction thyroid chondroplasty, or tracheal shave, which I think is where they take down the Adam's apple so it looks more feminine. Rhinoplasty, skin resurfacing, liposuction, mastectomy, penile implant, and voice modification. Kids. Combined with HB 1469, which has passed in both chambers, the two policies would allow youth from other states to run away from home, go to Washington youth shelters seeking an abortion or gender surgery, and the parents would not have to be notified. Also, none of the medical records related to any of those services could be obtained. And this is talking about people coming from out of state. So if your child up and decides, I'm running away, I don't like the way that you're not confirming my gender, you're not calling me Susie, I don't like that, I'm gonna go to Washington. They run away to Washington. Washington takes them in a shelter and they will give them their gender surgeries, whatever they want, and they don't have to let you know they're there, and you can't find out what they've done to your child. What do you think of that? What do you honestly think of that?
I am speaking to youth across our nation, across our state and our communities.
Rep. Tana Sen, D. Mercer Island.
I see you, I affirm you, that I hear you, that I love you. With this passage of the bill, we are saying Washington State does too.
One amendment added on the House floor requires OHY to collect data on the number of unsheltered homeless youth in the state, while another requires the Department of Children, Youth, and Families to offer a runaway youth referrals to behavioral health services and services to resolve the conflict and accomplish a reunification of the family. Existing family reunification services include short-term family counseling, crisis residential center services, referrals for substance abuse treatment and/or counseling, referrals for mental health services, short-term placement. Although SB 5599 does not address abuse or neglect, supporters speaking on the House floor before the April 12 vote conflated parents not accepting a child's claim to be the opposite gender as akin to unsafe home environment. So they see that if your kid, your son picks up a doll and thinks he's a girl, that if you don't affirm that and you don't treat that kid like a girl and let them know that they are a girl, that is abuse. That is an unsafe environment where they think that they have the right to take that child away because you won't play into their fantasies. This is fucking disgusting.
Kids' lives are literally at stake.
Rep. Nicole Marcy, D. Seattle, told colleagues,
This bill is intended to keep them safe.
but how do we keep them safe from these people? That's what I want to know. How do we preemptively protect the kids from this, from these sick, twisted people? The legislators rejected a proposed amendment from Rep. Jim Walsh, Republican from Aberdeen, that would have added language in the bill stating the lack of adequate affirmation of a child does not constitute neglect, treatment, or maltreatment in and of itself. The clarify of our existing law on what abuse and neglect is a helpful beacon in this confusion and misunderstanding, Walsh said. The existing statute that we have that defines abuse and neglect should be standard for the state stepping in and interfering with family dynamics. If a family situation does not meet the existing standard of abuse or neglect, then the state has no righteous role. Rep. Jacqueline Maycumber, a Republican, said, if I'm to understand the underlying policy is because those parents have kicked their child out of the home and they need a safe shelter. If there were signs of abuse, the state would be involved. That's not what's being said. You are saying that the state of Washington can take this child and not contact the parents with no signs of abuse, with no pending case of abuse, and the foster system not involved. That is shocking, and it is shocking. And this shit passed. This is a law. I mean, and we know this is going to pass in blue states. Get the hell away from blue states. This is the kind of shit that you're going to get in a blue state. I mean, I'm seriously contemplating Florida or Texas right now. Seriously. I don't want to be around a state that does this shit. They don't care about kids. Now, this is another thing that I want to show you really quick to show you just how low of an age this is going to, because like I said in my last video, they're going to keep going as young as they can. The pharmaceutical industry is going to push this as young as they can. And TikTok is the perfect way to market these surgeries and these ideologies, because that's what they are. This is an ideology. It's a mental illness that is being pushed ideologically, to kids. And TikTok is a major influencer. Just look at a couple of these clips where they're showing how happy you'll be after surgery. After you get surgery on your body, you'll finally feel like you're in the right home.
My favorite procedure in urology is a male to female genital reconstruction. But there are two reasons why I really love this procedure. One is that it is actually really beneficial for its patients. The study was published in JAMA Surgery not too long ago, and it shows that basically gender-affirming surgery significantly lowers psychological distress, tobacco usage, and unaliving ideation. The second reason I love this procedure is that it's really, really creative and is a very neat way to understand sort of sexual anatomy.
Hi, I'm Livo. I had top surgery 9 months ago. I used to dread getting ready. Dysphoria would always lead to a meltdown.
So this is the Seattle Children's Hospital, Gender Clinic. Gender affirming care at Seattle Children's. Seattle Children's Gender Clinic provides gender affirming medical care for adolescents whose gender identity is different from their sex at birth, who do not identify with the traditional definitions of male or female. We accept patients ages 9 to 16. If that doesn't make you sick, I don't know what the fuck is wrong with you, because that is disgusting. 9-year-olds. Now, they have to have already started puberty though. So we accept new patients ages 9 to 16 who have already started puberty. Patients ages 17 and older and patients who have not yet started puberty will be directed to community resources. Our clinic primarily provides gender affirming medical care such as puberty blockers and gender affirming hormones. Gender affirming medical care for patients under age 18 requires consent from any parent or guardian that has medical decisions making rights for that patient, unless the patient is an emancipated minor, or if they have run away now because that law passed, or if they have run away, are in a shelter or a clinic. Then the parent thing, what they're saying here, out the window. Doesn't fucking matter anymore. So services we provide: puberty blockers. Some people want to delay puberty from progressing. The option is available to youth who have started puberty but who have not yet completed puberty. The medicine to block puberty is called a gonadotropin releasing hormone, GnRH agonist. It stops the body from making the hormones that lead to puberty changes. Puberty delay is temporary. If you stop taking the medicine, you will go through puberty of the sex you were born into. We work with you and your family to decide if this is a good choice for you. We also talk about the cost and best time to start. Read more, which we know they want to start them as early as possible. And these permanently damage a child. There was an article that I just read where an 18-year-old was on puberty blockers, went in to get gender surgery, wanted a vagina, but because they were on puberty blockers, their penis wasn't big enough to construct a vagina. So they had to take part of their anus and it killed them, because these people want to make these kids whatever they think they are, no matter what. Just take body parts from here, take them from there, take a piece of my ass, put it in my penis, put this there, that. We don't care. As long as when I'm done, I'm the other gender. That's all that matters. Permanence, all that stuff. Forget the fact that a male who becomes a female is going to have to dilate that vagina all the time. They have to stick a thing in there and they have to stretch it. I believe it's daily. I don't know if it's daily. Don't quote me on that, but I know that it's a lot. And they have to do that for the rest of their lives. And they're on medication for the rest of their lives. And they're not disclosing that. Even if they are disclosing that to these kids, do you think they really comprehend the permanence of it? Do you think they really comprehend that they'll never have kids? Do you think that a 9-year-old can think, oh, I don't ever want to have kids. I'm never going to want to be a woman again. I want to be a man. That's never going to happen. Or I'm never going to want to be a man again. I want to be a woman. Or I'm never going to want to be a woman again. Wait, God damn it. I'm never going to want to be a man again. I want to be a woman. So let's chop it up. Chop it up. Let's do it. I ran away from home for this shit. So you're going to do it. But they don't understand the permanence. Hell, some of the decisions I make still today, and I'm 52, I don't understand the permanence. I don't understand the permanence of all those mochas with sugar. I've been told several times, cut out the sugar, stop eating sugar, which I have, by the way. I've stopped that now, but I'm saying it took me a long time. And even knowing the permanence of it, I ignored it. But I'm an adult. We're expecting children to understand irreparable harm to their bodies. It's sick. So that's what's going on up here in Washington and coming to a blue state near you. Are you ready? Are you excited? Are you ready to have your gender affirmed? Thank you guys so much for watching. No matter what platform you're watching on, please be sure to like it, comment, share it. I would appreciate that. And on all the platforms, there's a way to support it. If you want to support my work, I would appreciate it. Thank you so much, and I'll see you in the next video. Peace.